Hi there. How's it going? Not so good. Okay, well, that's why I'm here. The agency sent me over to check on you. I know that this is kind of a special situation, but I am a doctor and I'm giving you a home visit. So, why don't you tell me a little bit about why I'm here? You've been sick for 4 days. That's a long time to be sick. What can you tell me about it? Okay. Do you mind if I take some notes while you tell me the symptoms? If I have any questions while I'm writing down some notes, I'll probably stop you and ask you. Okay? All right. So, give me your first symptom. Sore throat. Okay. And how long have you had a sore throat for? About 6 days. Okay. What have you been doing to get rid of your sore throat? Just cough drops. Okay. That's fine. Can you tell me if you aren't using cough drops, like what your pain level is at with your sore throat? If 1 were like totally livable and 10 was unbearable, can you assign a number to your general pain? A 7. Okay, that's a pretty high number for a sore throat, which worries me. So I'm glad I'm here. And after you take a cough drop, what would you say that your pain level is at? A 4.5 or a 5? Okay. That's still pretty high, which suggests to me that this is probably a little bit more than just a sore throat. So tell me what else is going on. You think you've got a fever? Okay. Well, I'm positive that you do. Just looking at you, I can see that you're a little bit flushed, and that's all right though. Have you been experiencing chills and sweatiness as well? Okay. How often would you say that you get the chills? How about every 3 or 4 hours? Okay. I see. All right. How about any soreness? You did notice some soreness. Where would this be localized? Does it feel like it's muscular soreness, or is it something more like your joints? Like, does it hurt to move your elbows, or does it hurt to like move your knees, or does it just hurt all over? All over. Okay. Using the same scale that we used before, can you assign a number to the pain associated with this soreness? Okay, a 4. Maybe a 3. Okay. Could you compare it to any like previous soreness? Like after you go rock climbing? Okay. Yeah, I'd say that's about a 3. Alright. Has these symptoms been accompanied by a rash? Any skin discoloring or anything like that? No? Okay. How well fed would you say that you are? Given that you've had a little bit of fever and sore throat, I'm wondering if you've had any nausea as well. Okay. Would you say that's general or specific to just after you've finished eating? It's just general. Okay. That can be tough. I bet you don't even want to eat. Yeah. Okay. Using scale from 1 to 10 again, 1 being totally bearable and 10 being absolutely unbearable. Get me a bucket. Can you assign a number to your nausea? Okay. So you'd say it runs between a 2 and a 6. Okay. Yeah, it sounds very unpleasant. I'm sorry to hear that you're not feeling so well. I do notice that you have a cold sore. Have you always been getting cold sores? Is that something usual for you? Okay. I'm not so worried about it. It's just something that I took notice of every once in a while. You know, if someone gets really stressed out, they'll get a cold sore. But stress is also a really good predictor of getting ill, so you can see how they're connected. Okay. Have you been experiencing a lot of stress lately? You have. It's been because of work, I'm sure. Do you want to give me a number between 1 to 10 of how stressed out you are in your normal day? All right. Between a 6 and an 8. That is pretty stressed out. Well, hopefully I can help you get better and fast. I have one more question for you before I do a little bit of examination. Do you have your tonsils still? You do. Okay. Great. And then do you feel any kind of nervousness or anxiety having a medical visit? No? Okay. Maybe a little. I'm not sure. I think everyone gets a little nervous when they're at the doctor and wondering what's going on with them. That's totally normal. I'll just keep that in mind. When I check your pulse, I'll keep in mind that you might be a little nervous. Okay. Well, that is good for the symptoms, and I think it's probably time to just start the examination. So the first thing I'm going to do is just check your pulse, and I don't have my arm cuff, so I'm just going to have to take it with my watch. Is that okay with you? It is going to require me to hold on to your arm. Is that okay? Okay. Let me grab my watch really quick. Sometimes the ticking bothers people. Okay. I've got the watch. And now I just need your arm. Okay? And so it's going to be a minute of just listening to my clock tick. And maybe it'll relax you a little bit. Okay? Are you ready? Okay. Just keep breathing. You don't want to hold your breath while I'm taking your pulse. Almost done. Okay. Let me put the watch away. Sometimes the ticking does bother people. Alright. Well, let me just make a note of your pulse. I would say it's just slightly elevated, which suggests to me that there might be a little bit of nervousness, of course, but also that your body is probably dealing with an infection. So, I think the next thing I'll do is do a little bit of visual examination, and it's just going to require me to put on my glove and inspect your throat. It won't be uncomfortable. You just have to stick your tongue out, and that's it. Okay, are you alright with that? Okay. So I've got the gloves. I like green gloves. I don't know why. I just really like the sound of them. Not the color green, but the sound of the glove. Taking my time. Okay, so got my light, and what I'm going to do is I'm just going to have you open your mouth, and I'm going to touch your tongue, and just going to see what's going on in there, okay? Alright. Okay. Alright. And can you give me a big old ah? Okay. Well, it's looking pretty swollen in there. And there are some bumps. They're yellow, which suggests to me an infection. This is on your tonsils and on the back of your throat. Okay. Well, with that information, what I would like to do is use a little cotton swab and take a sample of the cells just on the outside layer of your tonsils. And the reason I want to do this is so I can take it back to the lab with me and make sure that my diagnosis is totally correct. Do you mind? It is sometimes a little gaggy, but I think it's necessary at this point. Okay, so I'm going to take out the light again. And I'm going to have you open your mouth, stick out your tongue, and say, ah. Ah. Okay. It wasn't so bad. So I've got this. I'm going to put it in the bag. Okay. Well, that's that. So I'm going to take that back to the lab and have that tested for you. My guess is that it's probably strep throat. Have you had it before? You have? Okay. And would you say that this experience has been similar? Yeah. Okay. What suggests it to me even further is that you don't really have any of like your cold symptoms, you know? Like you don't really have a stuffy nose or a runny nose or anything like that, which usually doesn't accompany strep throat. Okay. So, in the meantime, after I get this tested and get you your antibiotics, I was thinking that I could give you a couple things that might help you in the meantime. Do you take any ibuprofen or aspirin or anything like that? No. Okay. Well, I have a sample I can give you, and I suggest taking 2 of them. Probably, you're probably old enough to take 2. Just about every 4 hours while you're awake. You can start the clock when you wake up, and that'll be fine. And then I also will give you a quick recipe on how to gargle with salt water. That'll help you probably. Yeah. Have you ever done one of those before? No. Okay. Well, I've got the recipe for you. Let me just take the glove off. It's not fair when the glove is too small. Okay, so, did you want me to take your temperature, by the way? I can. Yeah, it might help to know what it is. Okay. Alright, so this is just an oral thermometer. We just use it and sterilize it. It has like a protective outer, and then the rest of it is sterilized. Okay? I'm going to have you open your mouth and close down for me while I take your temperature. I can confirm already that you have a fever. Yep, you have a fever. You're listing at about 101, 101.5, which is fairly low still, but is conducive with my earlier semi-diagnosis. I'm going to write this down for your file anyway. Okay, so what I was going to do for you before I got sidetracked was to tell you how to take care of your sore throat in the meantime. So I think that cough drops are probably an okay thing for you to take. You can probably take them every 4 hours with your ibuprofen. But I also suggest using salt water to purify and leach out some of that pus and infection in the back of your mouth. So what I usually do is run tap water, and if your tap water is undrinkable, just use boiled water instead, and let it cool. But what I do is I run the tap water on the hottest water and let it just run for a minute or so. And then I take a coffee cup and a tablespoon of sea salt and just mix it together. And then bring it into your mouth, and then, lean your head back and gargle with it, and then spit it out. It should be a little bit saltier than like a tear, but it shouldn't be unpalatable or so salty that you feel like you need to spit it out and drink regular water. So it should be salty, but not too salty. And this just kind of flushes everything out in there. So I would suggest doing it every 4 hours. And you may find that it gives you a little bit of relief as well, which is great. That's what I use whenever I have a sore throat. Do you want me to write that down for you? Okay. So that's 1 cup of water. 1 tablespoon sea salt. And then mix, gargle, repeat. And I would recommend your water be between 120 and 130 degrees. You want it warmer than your body temperature, but not hot like a cup of coffee, It's supposed to be warm and pleasant, not not awful. You do not want to scald your way out of this. That would not help. Okay, so I've got that written down for you. I'm just going to kind of write down your every 4-hour instruction for right now. So, every 4 hours after you wake up, you're going to take 2 ibuprofen. You are going to gargle with salt water. And then you can have a cough drop if you feel like you need it. If your results come back and you do have strep throat, you will need antibiotics. And you will just follow your antibiotic instructions. This can be separate. You don't have to worry about any kind of interaction with your antibiotic and taking ibuprofen. You'll be fine. So if you need antibiotics, you can just follow the directions on the bottle. Okay? Great. So I've got this little ibuprofen case for you. Inside there's just 16 tablets, and it's used as a pain reliever and a fever reducer. This is going to bring your fever down. It's going to make you feel a little bit better, but ibuprofen is not a miracle drug. So inside, got 16 of these little bad boys. The packaging is kind of nice. The back of it says, "I will carry the boulder for you next time. I promise." It's kind of funny. They suggest taking 2 at a time as well. These are just 200 milligram little tablets, so, or 2 tablets is 200 milligrams, which is absolutely fine for you. So there's 16 of them. And this is for you. Here you are. Just put that to the side. Okay. Do you need any more information from me? Why don't I'll give you my cell phone number. If there's anything that comes up that you have a question about, or you feel like is an emergency, feel free to give me a call. I'd be happy to field your call. Okay. So there's my number for you. It's on your instruction sheet. Just in case. Again, just in case. I mean, don't hesitate to call if you need anything. All right. Anything else I can do for you? No? Okay. How much rest are you getting? You've been sleeping a lot? That's good. You should. My suggestion is to take a lot of rest. Make sure you're eating. Make sure you stay hydrated. Follow my instructions. And I'll get back to you on whether or not you need antibiotics. If you do, I can have them delivered right to you. Okay? All right. Well, listen for my call about the antibiotics, and I hope you feel better soon. Okay?